The vertebral column can be divided into 5 regions. The neck region is your cervical vertebrae. Thoracic is kind of where your lungs and ribs are. Lumbar is your lower back. Sacrum, where you attach to your hips. And then the coccyx being the tailbone. And the cervical has 7 vertebrae. Thoracic has 12. Lumbar has 5. An easy way to remember this is these are kind of when you eat meals during the day, or at least when I eat meals during the day. So 7 a.m. is breakfast, 12 p.m. is lunch, and then 5 p.m. is my early dinner. The sacrum has about 5 vertebrae that have been fused. 1, 2, 3, 4, 5 spaces there. And then the coccyx can have anywhere from 3 to 5 fused vertebrae as well. So this is the main structure of a vertebra. The largest part here is the big body. And the body is made up of spongy bone with red bone marrow inside. And you can see it's got kind of this rough surface here. And that rough surface is to increase friction. So inside of this little area sits the intervertebral disc, and those are going to hold the vertebra apart and cushion the vertebrae. The vertebral foramen, so this is where the spinal cord is, and then the vertebral arch is this entire process over that foramen. There are several processes coming off of the arch. So these transverse processes are typically for muscle attachment for your paraspinal muscles. And then the spinous process in the back is again going to, this points behind you, right? So that's posterior. And this is also for typically muscle attachment. These articular processes are where one vertebra joins to the next vertebra. So superior means that this is facing up towards the head. So this would be like you're looking down on the spinal cord. And then these are going to articulate with the next vertebra above it. In between each vertebra, we have a vertebral disc. And these are made out of a fibrous outer shell here. And then the inside of this is called the nucleus pulposus. So these bind the vertebrae together. They actually resist compression because of the cartilage they're made out of, and they help to absorb, cushion the body from shock, because every time you walk or move, the weight of your body has to transfer down on your spine to your hips. Excessive stress can actually crack this annulus, which is made out of cartilage, and the nucleus pulposus can be projected out. So this is usually going to happen in the lumbar, so between L5 and the SI joint. And what's going to happen, so this is common in lifting heavy objects. So if you bend over just using your back and then pick up something heavy, it can put a lot of strain on these joints and actually push this nucleus pulposus out here. And then this causes pain because now it's touching this nerve. And when it touches the nerve, it gets irritated and inflamed. It sends pain to your brain saying there's something wrong. If this is the sciatic nerve, which you can find at this joint juncture, that pain can actually radiate all the way down the buttocks to the legs to the toes. So this is what we have when we have a herniated disc, where this nucleus pulposus, the central part, gets pushed out. The first group of vertebrae is the cervical vertebrae. And the first 2 cervical vertebrae have a special name. So C1 is right here at the top, and its name is Atlas. Picture in your mind the guy Atlas who has the world carried on his back. So he was condemned by Zeus to carry the world. And if you think about it, this is what your Atlas is doing. So your head is here, and that is your world. So your Atlas has to support your head. The Atlas is the bone that allows you to say yes. So if you tilt your head and say yes, you are moving the Atlas. C2 is the axis, and it's called that because it rotates around this central axis. So the axis is what allows you to say no. So if you turn your head to the left and right, then your axis is moving. The axis has a really large process here called the dens, which is also sometimes called the odontoid process, which stands for tooth. It looks kind of like a tooth. And that's how it articulates with C1 here and allows you to twist and say no. Cervical vertebrae have some distinctive features. So they're usually small, but they also have these transverse foramen. And these are the only group that have these transverse foramen. And these are so that arteries can travel through the bone all the way up to the brain. So the lumbar and the thoracic don't have transverse foramen because there's no arteries going to the brain in those areas. A thoracic vertebra is going to be a little bit larger. These usually have very prominent spinous processes that point posteriorly. One way that you can tell these apart is by looking at the superior articular facets. So in the thoracic, these facets point upwards. So they don't point towards each other, they point up towards the next vertebra. The lumbar is the 5 lumbar vertebrae in the next section. Their spinous process is kind of large. In general, these are the largest vertebra. This isn't pointing in that direction like this transverse is. And then one characteristic that's easy to use to tell apart is these articular facets are now pointing towards each other rather than pointing up like the thoracic vertebra. Then we have the sacrum and the coccyx. The sacrum fuses, it starts to fuse around age 16 and is completely fused by about age 26. This medial secant crest was the spinous processes of those 5 vertebrae that fused together. The coccyx is again fused vertebra. These are typically fused by the age of 20 to 30. These are vestigial, so this is what's left of our tail. And we no longer have a tail, but we use these for muscle attachment. So a lot of our gluteal and leg thigh muscles attach to this coccyx. And that's one of the reasons this is so painful. So if you've ever fallen down and kind of bruised or even broken your tailbone, it's extremely painful. And of course they can't set it or put it in a cast. But whenever you pull on ligaments or tendons like that, it tends to be a very painful break. These can actually be broken during falling or an accident, and it's common to be broken during childbirth too. So a woman's sacrum kind of curves in, and if that coccyx curves into the birth canal too much, then expelling the baby through the birth canal can sometimes break that coccyx too. So take a moment and reflect on the differences between the cervical, thoracic, and lumbar vertebrae.